Hello, everyone. Welcome to our final professional development webinar in this series this year, and in fact, the last of our grant, which will be ending the end of this month. We will continue some work into this next year, but we will not have further professional development webinars. So we really are pleased to be able to bring this one to you today. I'm Randy Longenecker, a professor of family medicine and assistant dean for rural and underserved programs at Ohio University, and associate director for rural prep. Dave, you want to introduce yourselves?
Yeah, sure, Randy. I'm Davis Patterson, and I'm the project director for rural prep, and I'm based at the University of Washington.
And hello, I'm Dr. David Schmitz. I'm a family physician in Grand Forks, North Dakota at the University of North Dakota, and I'm the dissemination lead for rural prep.
I want to welcome all of you as attendees, and hopefully more than attendees, participants today. We're using the Zoom meeting platform particularly for that purpose rather than a webinar format. And here is our agenda for the day. Today, our presenters are also our lead facilitators, and all of us, of course, are participants. If you have questions, please enter them in the chat throughout the course of our presentation. All three of us will then facilitate our discussion, beginning with some questions which we'll share with you in just a moment. But first, for any of you who don't already know, Davis will describe briefly what rural prep is all about.
And I'm seeing a number of familiar names and faces here. But just for the record, so rural prep is a collaboration among our three institutions representing departments of family and community medicine and primary care at the University of Washington, Ohio University, and University of North Dakota. And we built this on an existing community of practice and a nonprofit cooperative called the RTT Collaborative, which should also be familiar to many of you. Our mission is to improve and sustain rural health through community engagement and research in rural primary care health professions education. We do this, we're actually one of 6 HRSA-funded grantees, each with a different focus, and ours is training for rural practice. Our work is national in scope, and I'm sure you recognize the logos of some of our national as well as local partners there. And so they are folks that have helped us over these years that they share our mission, and they work to improve rural health and the health workforce. Next slide, please. So we are funded by HRSA, as I mentioned, and we're very grateful for that. And at the same time, I have to issue this disclaimer that what we present represents our opinions and is not endorsed by the federal government. I just read you off our mission a second ago, and this really, the work that we're doing here today really addresses our developing of a community of practice, but we also conduct our own research. We support research by others, micro research, if you've heard of that, and we work to disseminate evidence-based practices.
So here are our objectives, which you've seen in the promotional material, and they're integrated into an outline of our session today. I'm going to begin with some instruction on how to set up a design and dissemination studio. I will argue that at least half the work is setting it up to make it successful. And so I'll be talking about that. And then Davis will give us some advice on managing the actual event. Dr. Schmitz will talk about being a participant and a facilitator. And then we're going to invite you as an audience to join us, as we often do, to join our community of practice. Now, this time it's going to be with a twist. We acknowledge your participation today, and as such, you've joined our community of practice, but we really would like to see you continue to participate in the work of the RTT Collaborative, NRHA and its special interest group, the Rural Medical Educators, STFM and its Rural Collaborative, and the AAFP and its Rural Interest Group in carrying on this work. And so our purpose today really is to give you some advice on setting up a design dissemination studio so that hopefully you can do this in your own shop and in other venues to promote our scholarly work together. We do have a few questions for you as we go through our presentation today. And so we'd like you to keep these in mind. What aspects of planning and implementing a design dissemination studio are still not clear, even after we've given you our presentation. And then as a tactic for promoting scholarly activity in your institution or your program, where would a DTS fit in your curriculum, in faculty development, or in some other aspect of your work? And then for each stage of the process, how might a design dissemination studio play out in your place, or how might it look differently? So we've, over the past 5 years with Rural Prep, been wonderfully privileged to design and refine a process for promoting scholarly activity in the area of rural health professions education. And in promoting research that's well-designed and relevant to the rural communities which we all serve and in which some of us live. We found this process engaging for us, as well as for our learners and for the community of stakeholders who've participated. Hopefully, most of you have had the opportunity to complete the pre-assignment for today's webinar, the 10-minute summary of this process. And for those of you who have, we'll be repeating some things. You get to hear it a second time, but you also get to hear it not only from me, but from Davis and Dave. For those who haven't done the pre-assignment, we really encourage you to read the article that was published in the Journal for Healthcare Poor and Underserved in November, and view the 10-minute video that summarizes this process. Again, if you watch it following today's presentation, hopefully it will confirm some of the things that you've already learned. Our objectives in conducting a studio are very much aligned with the Community Engagement Studio from the Meharry Vanderbilt Alliance regarding cancer studies that inspired our process. There's just one important addition, and that is our purpose is to increase the relevance of research to a community of practice in rural health professions education. And we include not only physicians, but nurse practitioners, physician assistants, and as we go forward, hopefully other health professions in rural places. So the studio is framed around a unique process and a minimal structure that is intentionally designed and planned to succeed. And I'm going to go through each of these in turn. Here's an example of a recent studio we conducted online in January. Community is a widely used term today and perhaps overused, but it's defined in many ways. And so a first step in conducting a successful design dissemination studio is choosing the community of stakeholders with whom you wish to engage. For us, we looked around and decided to anchor our efforts in national meetings of a variety of groups. So the RTT Collaborative, National Rural Health Association, the National Organization of State Offices of Rural Health, American Hospital Association. And it afforded us an opportunity to target our studios to a particular group. Folks were going to be present at this annual meeting anyway, and it was simply a matter of engaging with conference planners to reserve a spot in the schedule and a location for a 2.5-hour workshop. The second key is to engage that community from the start. And generally for a national meeting, for us, it meant beginning a year in advance to try to get on their agenda. For example, in engaging with the National Rural Health Association, we knew an individual who would get us on the agenda and who could make a great co-host, and she has turned out to be just that. It's important to have a community member or stakeholder as a co-host to set the stage for collaboration, which is what this is all about, not simply filling a slot in the annual meeting agenda of the organization. And that individual is really key to recruiting a diverse group from that community and in assisting in conducting the session and setting a tone of mutual participation and respect, hopefully flattening some of the hierarchy that tends to emerge from a traditional research presentation where there's a sage on the stage. This is really a collaborative event, and we want to set that tone. We also started with the end in mind, and that is benefiting the community that we are engaging around our research. And then we set a time. We schedule a date, agree on a timeline, and this is our general timeline for implementation of Design Dissemination Studio, and you'll see why it needs to follow this timeline. We hope to, in the near future, place several downloads of templates that you can use in designing your own studio that basically help you meet this timeline. And then finally, choose a platform. Whether it's in person, you need to pay attention to sound. I think one of our first Design and Dissemination studios, nobody could hear the group that was discussing. And so it's important to pay attention to those sorts of things, the layout of the room. And then in this past year, we've learned how to do it online and have learned that a format that allows meeting interaction among participants is really what you want. You're not interested in a webinar format as such. And then we, keeping the community in mind and soliciting their help in identifying appropriate candidates and or topics, we invite two researchers or teams of researchers to each present a study, a proposed study, a study in progress, or a published or soon to be published study. And it's really important to plant the seed early that this is not a traditional research presentation. This is a design and dissemination studio, and studio is the important word. Rather than a show and tell, this is a problem-solving session in which all participants will benefit from the diverse perspectives that we bring together. You can certainly choose a theme to give the event some coherence, and we've done that on occasion. Other times we've just picked two projects that we thought would be relevant to the community of stakeholders that we're convening. The question that the researcher brings is really important. It has to be a genuine question that they are asking of the stakeholders, not a rhetorical one or a teaching point. We really want help with our research, and that's why we've come to this studio. We recruit a diverse group from the relevant community, however we define that community, and one that may or may not be closely associated with the topic or the themes. We've found that sometimes inviting people who think that the topics have nothing to do with them are the most able to bring that outside perspective and help us in making the research study a better study or better interpreting the results. We deliberately recruit for a diversity of perspective, not expertise. So we include students early in their education, community members who know little about the topic but may have a stake in it, researchers from a variety of research traditions, policy folks, administrators, all are welcome. Recruit for racial, gender, socioeconomic, and geographic diversity. So this is one of those situations where you just don't sign up the first 20 to 30 people that register. It's really a matter of going out and handpicking a group. We've done a pretty good job, I think, in the past 4 years that we've been doing this, but hopefully you could do even better. 20% of our participants were non-traditional participants, that is, people who you wouldn't expect to come to a research presentation. Generally, we restrict the total number to 24 to 30 individuals, including facilitators, so that the larger group can be divided into 3 or 4 smaller groups of 4 to 6. To facilitators, you've got a group of 8 already, and anything larger than that really gets hard to manage. Incentives can help, but I think personal invitations work even better, especially when they come from a respected community member or an individual with whom they already have a trusting relationship. We've used travel and meeting support, meeting discounts, honoraria for the researchers, but really the problem solving that this offers to the researchers is incentive enough once they've done one of these or participated. And of course, we've had students present and they get to put it on their CV, and it helps to pad their application for residency. This event does require a lot of preparation, and that's why you need to start 90 days out, because it isn't the usual research presentation. You need to coach the presenters. I think that researchers, especially many of the established researchers, are used to doing it the usual way. And so even when I've coached someone in this process, sometimes it doesn't completely work out. The researcher's purpose is to briefly present the participants with just enough information about the study to help them answer a genuine question about how the researcher should proceed in their work. So my work as a planner has consisted of phone, video conference meetings, emails with questions, regular prompts to meet the deadline. I need to fully understand the project myself if I'm going to host the studio, and if I'm going to coach them in arriving at a succinct, focused presentation, just enough, but not too much to engage the audience in the question, answering the question at hand. And it really is coaching. I got better at this, I think, as I better understood the process myself, but not being an expert helped set the tone for the problem-solving event and for the show. The research question is not a question that the research is attempting to answer, but rather it's a procedural question. How can I proceed from this point? It's not about making the question better, but maybe more appropriate to the process. So there are many good questions that come to me from researchers, and I might say to them, well, that's a great question, but I want you to ask a question that will engage this audience and will get them excited about it. They need to be an open-ended question. And you want to invite unexpected new perspectives, things that I hadn't thought of ahead of time. The question needs to be oriented to action. How questions work a lot better than what or why questions. A beautiful question is not simply a pretty or eloquent one, but one that actually leads to actions. Raw questions, unvarnished questions are good. Some researchers don't get it their first go around, but in this process over the last 4 years, as we've done this over and over again, as we've participated, we get better both as hosts and as facilitators, but also as research presenters ourselves, because we have presented on these occasions. For the participants, there needs to be some preparation as well. And the task for the participant is really to bring a unique perspective and a critical mind to the work of answering the researcher's question. It's not necessarily to generate more questions that always happens in a research presentation, or to give the researcher advice for answers or answers for which they didn't ask. You are simply there to answer their question. It's very researcher focused, researcher centered. You can always contact the researcher later and offer suggestions or additional background materials or work that you've done, even collaboration. But the purpose of the studio is to work on the question. And promotional materials and invitations make it clear that you welcome both novices and experts, and restrict the amount of pre-work to an amount that is easily accomplished. We've generally restricted it to about an hour total, or no more than 2 hours total. And here's where you get to leverage your incentive if you have an incentive, and that is you are given this incentive in recognition of the work that we are intending for you to do before the meeting. And then, of course, don't forget to prepare an evaluation. Prepare to better prepare the next time. And with that, I'm going to turn it over to Davis to talk about the day itself and how you might manage that.
Thanks, Randy. So this is just an overall outline of what the event looks like. We spend about 2.5 hours facilitating the studio, starting out with introductions to each other and to how the process works, going over some of the things that Randy just described to get everybody on the same page. And then we have 2 55-minute research sections with a 10-minute break in between. And then we have time at the end for evaluation and feedback. And I note, about 5 minutes there for cushion because, things never go exactly as you plan. Next slide. And so this shows you a snapshot of the DDS agenda that from the one that we had in January, and this highlights a research session. And so in each research session, first of all, it begins with the researcher's presentation, followed by 2 or no more than 3 questions. I think 2 questions is kind of ideal. For a proposed study, perhaps what are we missing? For a completed study, who needs to hear this information? How can we share it and reach them for maximum impact of the findings? And then there's an opportunity for about 5 minutes to ask clarifying questions. And that's really just focused on what anything that the participants did not understand about what the researcher presented. It's not a time for them to get into discussion of what's the greater meaning here, or what's my advice to you. It's really just to clarify what was presented. And then following that, the people go into small groups, and as they're doing that, it gives them a chance to reflect, to answer the researcher's questions. So they spend about 15 minutes if it's a Zoom breakout with an assigned facilitator. And then there's time to reconvene in the larger group with 15 minutes to report out from each of the groups, and a little discussion of what's their answer to the question, what do they recommend. All this time up until the last 5 minutes, after the researcher presented and all the way through the consideration of these questions, the researcher is just listening. That's their job, is to listen and learn from what people are saying. And then the last 5 minutes, they have a chance to talk again, and they get a chance to respond about what they've heard and how they plan to proceed. What are their next steps? What insights did they gain from the process? Next slide. And so we've done 4 DDSs online so far, and given that experience and then our in-person DDSs that we've done, we wanted to share what we learned in adapting to an online world. So now we do think that these events are best implemented in person, but we've improved and continue to perfect that online process. So first of all, as you probably know, for doing online meetings yourselves, moving to people into breakouts instantly, that does save time. And the nice thing too, with the DDS, we talked about diversity. It allows us to purposefully assign people to ensure group diversity. You can do that in person as well, but it's easier to do that online. We also need to add staff roles to manage the online environment. That's really important. You have to have that technical person behind the scenes that can help with any issues with Zoom or whatever platform it is. Someone to look at the chat and make sure that concerns or issues there are being addressed, or questions or what have you. And then you need to have a breakout group facilitator, somebody who knows what's supposed to happen, what the group is supposed to be doing in that Zoom breakout. That's something that in person, the facilitator can go around and sort of check in with groups more easily, then you can do that in Zoom as well, but it helps to have somebody facilitating the breakout group that's assigned and right in the room with them. And then finally, you need to budget time at the beginning of a Zoom meeting to establish rapport among the participants. This happens somewhat naturally in person as people, filter into a room and they're chit-chatting and meeting whoever's next to them. And as we know, that doesn't really happen as easily on Zoom. And so we learned this after, I think, the first one. And what we decided to do was put 6 minutes at the beginning for a meet and greet. And people are assigned to a specific breakout group at that time. And that's the same group that they meet in every time that they break out, just so that they establish that rapport. And so in that meet and greet, they get to talk about, who they are, what's their reason for participating. And then we also ask them to choose a reporter. Next slide. And almost as if planted from one of our online DDSs, after we worked on making some improvements, this one of our participants in the evaluation said, "Great design with an organizer, facilitator, recorder, as well as small breakout rooms." And I thought you nailed it. And I thought that this last question here was interesting. Someone asked, maybe this is more focused even than a discussion at an in-person conference. And in fact, we know that online meetings do have some advantages over in-person meetings. And so in terms of, being productive and giving everybody a chance to participate. So I think that this quote actually hints at some advantages of the online world for a DDS.
Okay, Dave.
Next, well, thank you, Davis. And I have the opportunity to talk a little bit more about the small group process. And in the Design and Dissemination Studio, everybody has a role. It's really a gift to the researcher and the observers with regard to the feedback that they're receiving from this community of stakeholders. And so some are in the role of being the host, the researcher, or a participant, but it's a collaborative process in the end. And the participants really are valued as they're the community of stakeholders relative to the research and the questions that are posted by the researcher. The facilitators are actually encouraged to contribute, but sparingly, both as participants and facilitators. Their main role as a facilitator is to keep the group on task and redirect sometimes away from other wandering discussion back to the question at hand. The amount of time assigned to the small group at first seems like it's plentiful, but it goes pretty quickly. And so keeping the group on hand with regard to this is really important. And there is typically two facilitators, one who's tasked to keep the group on task, and then the other is actually taking notes. However, one of the participants is generally chosen at the beginning to be a reporter and to report out to the group. As you'll see how the small group findings are then reported back to the group, including the researcher, and then a subsequent response. And so the observers and the researchers at this point are not participating in the small groups, but will be waiting for those report. And so again, the comments that the reporter will give should be succinct because of the time limitations and not really be a comprehensive sort of rehash of the group's discussion. Next slide. And so you can see from the time scaling that the small group discussion is relatively a limited amount of time, but there is time that's allowed for the reporter to report out and then there to be some discussion about that and a researcher's response. The important part about this is that the facilitator can also, during the discussion, help to bring out some of the perspectives of the non-researchers, those that are perhaps not seen as experts. So some of the students or learners, all of who are really part of that community of stakeholders, and in particular, whether the researcher's question relates to a research design question or completed research, it may be actually a dissemination question. These perspectives can all be very valuable back to the researcher. Randy?
We just wanted to share with you some of the comments that we've gotten, both in immediate feedback at the time of the sessions, but also we did a retrospective review after a couple years to check in on people as to what they remember. And here are some of the comments that we got from participants, and I'll let you just take a look at those. And then, although we didn't survey the researchers that had participated over the last several years in any formal way, the participants were able to at least project what impact this might have on researchers. And in fact, as researchers who have presented in this studio, these are all right on target. All right. Well, that's the end of our formal presentation, but we want to really take the rest of our time together, and it's a small group, so we want to encourage all of you to participate, enter into the chat, but just unmute yourself and raise a question as well. We're going to start with our first question for you, and that is, what aspects of planning and implementing a DDS are still not clear to you, or that you'd like some clarification about? And so we'll start with that discussion, and the three of us will lead some open time together. I'm going to stop sharing my screen to allow that to happen.
Hi, this is Megan Ruddy. I have a question about that. So essentially what you are, if I could teach back what I took away from this, essentially what this is sort of a focused workshop.
Mm-hmm. Yeah, it is. I mean, it's a working meeting. It's not so much a presentation as it is a working meeting where you engage a diversity of perspectives around your research project.
Okay, so it's essentially more to get actual or potential stakeholder / mentor / community input on concepts as they mature and develop, and not necessarily so much about, I guess I'm kind of curious about, I understand the design studio part. What's a little bit more about the dissemination studio part?
Yeah, so we had one study that was presented by the UC Davis folks regarding their study of community college students who then went on to medical school and how they're more likely to go into primary care, et cetera. So they were presenting this as a completed project ready for dissemination. In fact, I think they had already published the article. That was the pre-assignment, was to read the article. And unbeknownst to us, since I wasn't the one recruiting the group, there was a fellow sitting right in the front row who had been a community college administrator in a past life. And so it was just great to have him be able to bring that perspective to this research study as to how it should be disseminated, who needs to know this, and what do you do with these results? You want to make any? Oh, go ahead.
And I promise that I will be quiet after this question.
No, please.
So I guess my question is about, and I'm sorry to kind of maybe deflate the conversation to the level of ACGME Web Ads reporting, but in terms of dissemination, what counts? Would a dissemination via presentation in this kind of environment count, or is this more kind of a an added value situation where people are really there to get input and ideas for additional places for a dissemination?
I've spoken already. You want to answer that, Davis or Dave?
In my estimation, it would likely be the latter, with regard to engaging a community to determine how dissemination can be more effective or more impactful, or could even be disseminated to groups to which you are unaware that the research might have value, the completed research project. So So I think it would depend on the question of the researcher, unless that question itself was fulfilling a presentation requirement. But the the dissemination, as opposed to the design, is really about how can the research be more impactful, even where we have blind spots, for example. As Randy said, by having a diverse audience engaged, we learn a lot about how the journal article, peer-reviewed journal article, might not be the most, or even the only, of course, way of having an impact with the research itself.
Anything to add, Davis? I
Well, I guess I would, you know, and without being familiar myself with the specific ACGME requirement, since I'm not directly involved in residency education, but I do think that perspective that Dave just mentioned, and you know, when researchers deliver a presentation at a, you know, at a research meeting, or you know, in front of an audience that's looking for research findings, I mean, that's really about sharing, you know, here's the new knowledge that I created through my scholarly activity. That's not so much the focus. That's sort of the preamble in a DDS to, all right, you know, how can I make the world a better place with this information, right? And so that's the different focus, I would say, of the DDS.
But I will say, as a previous program director, participating as a presenter in this studio absolutely counts as dissemination. And if you do this with a national audience or international audience, as we have done, it's an international presentation. So especially when you do this online, I would count this. I really would. It's great faculty development also, because people get feedback on what they've done and get new ideas. So it certainly counts. Is that the question you were asking? I'd put it in my web ads.
Yeah, I guess. And so, you know, so I work for the Wright Center for Grad Medical Education, and we are working on a couple different versions of potential rural programming. And then we work in consortia with other rural programs. And even in our non-rural programs, it's always that question of scholarly activity for faculty and residents. And I'm always looking for opportunities to kill multiple sections of web ads with one action. And so to me, this seemed like, and we've done this in our organization, we created because we have a program, a family medicine program that's multi-state, we created essentially an internal opportunity for presentation that counts.
Yeah.
And I thought, oh, maybe this does too. And then as you were talking, I was like, oh, maybe that's not really the point, and I'm kind of overstepping in that assertion. But it seems like it's potential. I love the idea of not only is it for a finalized project, a presentation of a project, so scholarly presentation, but also that it could also count as faculty development. So that's 2 boxes. But then also that it could potentially be a springboard to actual publication, which would be a potential 3rd box. So it's actually a really valuable, it's sort of in kind of the dirty operational mind of somebody who administers a program. I love the idea of disseminating to the community, and I have thoughts on that as well. It's awesome. But just in terms of the practicalities of it, this is really a very practical approach, and I very much appreciate it. So thank you.
Excellent. Yeah,
And
you've got a national audience just within your sponsored program at the Wright Center.
And as a department chair and former program director, I can certainly say that the design portion of the DDS can be incredibly valuable with regard to not only honing and improving certain aspects of a pending or yet to be completed research project, but also in a faculty development way. Specifically, how do we engage communities with regard to community engaged research? How do we formulate questions that not only can be perhaps published someday in peer-reviewed literature, but have meaning and impact. And it's sometimes the nuances of how a question is asked, or in my case, I had the ability to be a participant in a DDS. So I had to be quiet and wasn't in the small group, but I received feedback because we were looking at factors that related to how rural communities could make the most of their assets and some of their limitations around being good rural campuses for health professions education, for primary care, And we didn't want to miss out on some of the most important factors. So we were able to engage a community not only of medical educators, but really of those who knew what resources they had in their rural communities and what kinds of things were important in their experiences, whether they were successful in hosting a learner, a student, for example, or whether they had actually had difficulties. And so that was very unique opportunity for us to hone our questionnaire. But for other faculty, it might be even just direct feedback on how to ask a good research question, or ask it a little bit differently in a way that would ultimately be more meaningful to the community of stakeholders. And that's great scholarly activity, faculty development, in my opinion.
I've got
Any
a-
other, go ahead, Darren.
and this relates to the context for these things. Most of what it sounds like people have been talking about are on larger scale in the context of regional or national meetings or organizations or things like that. But this also seems like it might be a really good venue for local within a residency program or a departmental or a college-based situation. Do any of you have any experiences of doing that sort of thing? And then I'm thinking, okay, well, 2.5 hours may be a long time to get a local group together for something smaller, maybe breaking it into parts and just doing one presentation and doing them one at a time as a series of these things. Are y'all familiar with that? And has that worked successfully in places?
Well, I'll have to say, we've spent these 4 years refining our process. And since none of us is currently a program director, I haven't had the opportunity to actually try it in a residency program. But if I were still a program director, I'd be thinking, well, we could do this quarterly. And let's see, we have 8 residents, 2 each time. We could do this as an internal way of helping our residents and faculty design their research studies, as well as come to or get some help in deciding about dissemination, et cetera. How would it work in your place? Because you're distributed also. You aren't distributed quite like the Wright Center, but you have 2 places.
Yeah, and I'm thinking a couple of different ways, because we're a community-based program, but we're affiliated with a university without a medical school. And so on the one hand, we've got a scholarly project-focused group among the faculty, which spans both sites that using this process to look at individual projects and the design of those individual projects within the program, and or the scholarly processes that residents are involved with. I'm also thinking on the other end, dissemination piece, because we've got a College of Health at our university that's looking at getting all sorts of other health disciplines out into rural areas like we are as a program. And, would there be information that we're gathering or doing that might be useful to other disciplines that we wouldn't have any idea about, and holding things like this so that different disciplines could have the opportunity to talk to each other about these sorts of things and figure out. And then lastly, also with regards to kind of what was said previously, the rural communities that we're engaged with, because they too could have completely different perspectives on some of the stuff that we're doing or trying to collect information on that we wouldn't even think about as our semi-isolated selves in our educational little empires, I guess, that aren't necessarily out in the real world, so to speak.
Yeah,
I
so
think that's-
inviting members of the community in your rural sites to participate in an online event like this, as well as having presenters who are from different disciplines, different colleges within your university. That's great.
I think that's
I was just
exactly.
going to I just wanted to mention, we adapted this from a process that was originally developed by the Mary Vanderbilt Alliance for cancer research, and we've adapted it over the years. And I think that's testament to that it's a very adaptable model that can work in many contexts. And as you mentioned, we threw a lot of resources at this because we were funded to do this. We paid people to show up at meetings. Notably, in our last DDS, we offered folks a discount on their registration to the NRHA conference. Very few people actually took advantage of the incentive, and we had quite a number of people show up. And so you don't have to have a lot of money, And so I think that's an important thing to know, that I think that this is doable and scalable to different contexts.
And I was just
Of
going
course,
to add,
that might also have to do with the fact that NRHA overlapped exactly with STFM this year, so that may have impacted those who are willing to take advantage of that incentive.
Absolutely.
I would just add, as a department chair, as I think about implementing this further down the line at that level, just like you said, you could have those involved be the residency program, the faculty. You could certainly have other experts in the room, such as a statistician or someone who's very knowledgeable about IRB, for example. But at the same time, as you said, engaging the community members, does that involve patients, or does that involve community interests that are not well represented by the traditional sort of bringing our faculty together to discuss a research question or a research methodology? Really beginning to look more broadly than that, and then guiding that with regard to making sure it's coincident with the researcher's question. Because the researcher, again, it's not about presenting their research, it's about a couple of focused questions. And so if the question is, for example, how could I study what I'd like to study, but have it be most meaningful to the community of stakeholders, and that might be our rural patients. When we begin to think about the question that we'd like to answer, that can help you hone both the diversity and some of the focus with regard to those you'd like to have most participate.
Anyone else? I see some other residency folks, but I think there are some medical school people too.
So my name is Pat Bricker. I'm with the Pennsylvania Area Health Education Center, and I love the model. I think one of the things that is surprising to me in what you presented is how short the actual discussion time in the breakout sessions is. And having participated in a number of, different webinars and meetings, and you go into breakout sessions, I mean, I appreciate there's like sort of the let's get acquainted kind of breakout session first, but still, I mean, one idea can spin off into, a 10-minute discussion in and of itself, or even longer than that. And so I wonder how you get that many ideas to come out in such a short window of time. I mean, I appreciate the, the focused question, but the logistics of that is just mind-boggling to me.
Well, it is really important to have a focused question and to have everybody understand that they're not there to follow every rabbit trail that they can think of. The researcher isn't looking for more ideas. What they're looking for is an answer to a question. And so if you keep it really focused on the question, the time pressure is almost a good thing because it really keeps it focused. We have only 5 more minutes, and we haven't heard from the student. What do you think? That's the role of the facilitator.
I think the other thing that is helpful is that there is a period for clarifying questions about the project in general. And so even though people won't have every question they'd like to have already answered at the end of the studio, there was that pre-small group breakout opportunity to ask the big questions. And then when we come to the breakouts, if you can display or screen share, for example, the 2 questions, or at least have the facilitator say, we have 15 minutes for the 2 questions, and here's the first question. Okay, we're at about half time now. It really does work well, and people seem to be able to stay focused for that purpose.
I think the structure of, or the having the in the breakout, in the Zoom environment, having a facilitator assigned to a breakout room helps to keep people on track. If it's in person, the reporter has got the pressure on them. They're going to have to report out. So someone will be trying to say, hey, we've got a question left to answer. That's really important. And the other thing is, you probably could talk for, half an hour or more. And so you won't be able to get every idea out, and maybe that you will go on a tangent, but across the larger group, most of the issues I think that are going to be helpful will get surfaced. And so there's some trust in the process. I think that's important.
There's a lot that also happens after the meeting. So for example, we had a medical student present a research study, and after the meeting, people were coming up to them and saying, well, we could help you with this, or we have some ideas. And that student then was able to continue to engage with those folks afterwards. So it's enough to start the discussion, if nothing else.
Thank you.
I just wanted to comment. I participated in one of these about 3 years ago, and I didn't know what it was all about, and I didn't understand the concept, and I was really kind of lost just as a participant. I think I understand it now, but thinking about implementing this in our small community and stuff, if we find ourselves misstepping and we need resources, are you three a group that we could reach out to?
Absolutely, yeah. I made a lot of the fact that our grant was ending, but in fact, we have an extension this year. And even after this year, each of us individually is very invested in this after having done it for a while. And we'd love to answer questions or interact with you in problem solving around anything you might encounter. So you are free to reach out, and we'll have our contact information here at the end for you. And
Just
if you can-
seconding that. And anything rural prep related, for, as the years go by, if you want to get in touch, please do.
I will say one thing, we did not record these generally, so as to keep the conversation very free flowing, and plus it was harder to do that in person. It's only since we did Zoom that it became easier. But we did record one, and it's on our website, at least a half-hour sort of snippet. So if you want to watch one, you can do that. Any other questions? We have about a minute left before I go to the last part of this. Let's see, did we get the one in the, oh, got the chat? Anyone else want to say how they're going to use this? That was our final question. What would it look like in your place? We did hear a little bit about Right Center and Montana, but any other thoughts about what you're going to do with this? I'm going to go ahead and share my screen again here.
Randy, I would just say that I think it's a powerful stepping stone toward community engaged participatory research and guiding faculty not only in a sphere of expertise, but in a sphere that is considerate of those implications, whether it be design or dissemination. And that is somewhat unique, I think, in many academic settings.
I also want to say that I think this is a situation in which you are encouraged to fail. So, Stephen, if you run into difficulties and you really mess up, you'll learn from that. And we failed in our first online event to really engage the group. And so we learned. Well, I just want to say thank you so much for participating, attending and participating today. And here are some resources that will be included in the PDF that we send to all of you after the session today. And we want to hear from you as to how you thought the session today went, anything we could do to have made it better, and give us feedback around both the topic today as well as the general process. And here are our contact information. And you are encouraged to contact any one of us. I think JP also put this in the chat, the link in the chat, so that you are able to access the online survey. And I think finally we'll just say a couple things looking forward. The RTT Collaborative is planning to do a design and dissemination studio in January, and each January we're going to do that in combination with our micro research community, and also as a faculty development event online for rural faculty. So be on the lookout for announcements around that. As I said, we handpick the participants. And so this is an by invitation only event, the DDS itself, but we're going to wrap around it a faculty development event. So some of you may be able to participate. If we reach out, we may be looking for presenters. If you think you'd like to present in this venue, let me know, because the RTT Collaborative will continue to do this every year. And there is a possibility that the National Rural Health Association will be interested in accommodating this from time to time. Same with STFM. It would make a great workshop presentation at any of these national events.
I'd just like to add that if you do do a DDS, and we would like to hear from you. We would like to know how it went. So so it's not just about planning or advice, but tell us if you did it. I think that would be really interesting for us to learn what your experience is.
Absolutely. We want to know how it works out. Well, thanks again for your participation, and I'll leave this screen open for a while for everyone to complete their evaluation. Have a good rest of the week.
Thank you, everyone.
Thank you.
Thank you for attending.
Looks like we're down to just the four of us. Any post brief?
I think that went really well.
It was fun. I hope those who attended got something from it. It's a small group, but I think that should record well, and hopefully people can access this in addition to the other resources we put on the page. I do think it would be good. So I was going through this again last night. I was thinking we really do need to upload for download templates, like the planning template that we use.
That would be nice.
I think that would just really be helpful. And also a process document. Here was the process we used.
Yeah, I think that would
Yeah,
be
that's part of the kit.
Part of the kit.
And this will really nicely accent the article. I really wish the articles were open access. It was evident yesterday as I was disseminating Andrew's article on K through 16. It's a barrier, if people don't have library access to access these articles, unfortunately. But still good to have them out there.
Well, the other thing is that you're allowed to use articles in teaching. And so, for example, we could have made the article itself available for this group. We can't put it on our website as a download, but you can use it as a handout in a teaching setting, right, Davis? Is that, am I bending the rules too much?
I think that's probably okay. I mean, I think if we had 100 registrants, that might raise some concerns, but in a small group like this, this is a very niche. The DDS, I think it's a very niche audience, and so I'm not surprised that we had a smaller attendance than we would for some of our other webinars. And so, but yeah, I generally would think that would be fine. All right. Well, the grantees are having a debrief meeting right now that I'm going to attend, and I don't know if you're excused if you don't want to attend that. So I got to transition to that one.
Yeah, I was going to make sure that one of us was going to attend. So thank you.
Yeah, I'll be there. And thank you, Randy, thanks for pulling this all together.
Yeah.
I think you did a great job on it. And
I do too. Thanks, Randy, for leading.
It's our swan song. So
Yeah, this was fun.
for this, iteration of our collaboration anyway. So, okay.
All right.
See you
take care,
guys.
I know. Thanks,
Yeah.
Randy.
See you in a
Bye.
couple hours.
Bye.